Single-payer, government-run health care. A group of House Democrats now pushing a bill that would transition our private system to one run by the government within just 2 years, with no price tag attached. Hi, everybody. This is Bulls and Bears. I'm David Asman. Well, you can bet our panel is going to have a lot to say about this and more. Here now is Susan Lee, Jack Howe, Scott Martin, and Steve Forbes.
It is time to ensure that health care is a right and not a privilege, guaranteed to every person in our country. It is time for Medicare for all.
So that's how they were rolling it out today. Folks, the bill covers everyone, not just the elderly or disabled, with no copays, premiums, or deductibles. You can go to your doctor of your choice, and it covers everything, including vision, dental, and mental health. That's even more than Canada's socialist system covers. They also say they will have the power to negotiate lower drug prices, but again, no price tag, no explanation attached. What do you make of this?
Well, you wonder what they're smoking. First, drugs are about 11% of overall health care costs, but on saying it's Medicare for all, they're using a name that people like to cover socialized medicine. And under socialized medicine, David, the way they actually control costs, since everything is free, is by rationing. So you don't get those operations when you need it. You don't get the treatments when you need it. In England and Britain, if you need kidney dialysis in your 60s, forget it. You're going to die. They're never going to let you have it. The other thing it does is crush research and development, and that means we're not going to get the medical devices and the drugs we need to deal with things like Alzheimer's in the future. Then you look at Europe, wants a great font of new medications, new medicines. Now the U.S. is way, way ahead. Europe is stagnating.
You ask what they're smoking. This might actually provide full coverage for whatever they're smoking.
That's right.
Take a look at this is a good old-fashioned lefty overreach, right? This is what they do on the left all the time. They have a kernel of an idea here, and in fairness, we must say that Republicans have done nothing on health care, have provided no alternatives here. If you poll people in America, you say, "Are you for Medicare for all?" People, if you're talking about giving them an option of buying into something or keeping their private health insurance if they like that, I think most people would be for it. If you're talking about clobbering everyone over the head, taking them out of whatever they're in now, whether they want it or not, and shoving them into Medicare, I just think it's too much too soon. I think most people don't like it. This is an overreach.
So Kaiser Family Foundation did a study, and they said 56%, when asked about this, they said, yeah, I would back it. You know, the number dwindled quite dramatically when they were told how much they might have to pay for it, because that's the reality. Somebody has to pay for it at this point. I think estimates are out there are saying $3 trillion. That's like, it's $4 trillion right now for the entire government budget each year. Right. I'm not sure it's affordable.
I think they mean per year, Susan. I mean, that's the problem. There's no details to this plan. And I'll tell you one other thing that kind of concerns me that Steve touched on. It's innovation. I mean, if you look like it, the report recently out of the American Association of Medical Colleges talking about the doctor shortages that are going to be out there in the next few years. Guys, just wait until, and this is still while we have private care, just wait until the government gets into this scenario and tells the doctors what to do, what to prescribe, how to operate. Can you imagine the doctor shortage, the nurse shortage we're going to have in this country? Because they're not going to want it to get in practice. If they're having trouble getting to practice now, imagine if the government's involved there. That's going to totally destroy the standard of care in this country.
You know, I sent a copy of this to Dr. Mark Siegel, our resident doctor expert on all these things. He sent me back this poll. 90% of physicians oppose single payer, this kind of single payer, essentially socialized medicine. 90% oppose it. Already, you have 30% of physicians in the United States refusing to see Medicaid and Medicare patients because they get paid too little. They have to deal with all this paperwork, even more than insurance companies. It's a mess.
It is a mess, and there's no reason why doctors today are bureaucrats. 25–30% of their time filling out forms, being online, just to go along with this stuff. Out of the Centers for Medicare and Medicaid, 11,000 pages of new regulations each year. How in the world do you get a system running with that kind of stuff? So it's bad enough as it is. We should be going the opposite direction. More free markets, more effective safety nets instead of more government control.
We should point out the chance of this becoming law right now is 0.0%. This is going nowhere right now. However, there's a warning here for my Republican friends. You got to provide alternatives. Don't let this be what we end up with by default because you were afraid to try something new.
Well, he was just talking about new ideas.
Trump's talking about drug prices, Jack.
Let's see some legislation, right? And I'm all for free markets, but we can't just say free market, free market, free market. That's what's going to work when people are getting clobbered right now by healthcare costs. We need a couple of.
Let's take something more basic than healthcare. Food. Without food, nothing else happens. Right. We don't have government running farms in this country. If we did, we'd have no more obesity. We'd all be starving. And so you let farmers.
It's not the same thing for just one reason, and that's because demand for healthcare. When you see a loved one hurting and you say, "What's your willingness to pay?" the answer is always anything, everything I have, everything I can beg, everything I can borrow.
The point is, by allowing free enterprise in the agricultural sector, we have plenty of food and people have problems. We have everything from food stamps to food banks to deal with it. Why in the world can't we do the same thing in healthcare? Have that basic coverage like we do with food stamps if you can't afford it, and let free enterprise run free and reduce the cost of healthcare and get more health care for less. Just as we do with LASIK surgery, costs 40% less in nominal dollars than it did 12 years ago.
That's because it's a free market.
It's a free market.
Exactly.
But I think the point this week when you hauled the pharma CEOs in front of on Capitol Hill talking about drug pricing, why does it cost more in the U.S. to buy your pills than it does elsewhere around the world?
Because of a very basic reason. We provide the $2.6 billion it takes to bring it in research and development, and other countries don't pay for it. They have governments that say to these pharmaceutical companies, in effect, with all the subtlety of Tony Soprano, you don't give us this at the basic cost, we're going to steal it. We're going to steal it from you. That should be a trade issue. They should pay more R&D.
You let them get ridiculous patents. You let them get ridiculous patents, though, too, Steve, so these drugs can't go generic, so therefore you can't have competition. And I'll tell you, Jack, I mean, President Trump has taken a pretty hard line on drug prices this year. That's been one of the things he's laid out pretty explicitly. So if you're talking about a president that, I agree,
it's jawboning, though. Prices went up the first couple days of this year. It was jawboning.
No, listen, they're going to push on drug prices because that's a place they can start. I mean, if you look back at that list that the Democrats proposed where no co-pays and things like that, that stuff's totally unrealistic. But if you go after these drug companies and actually bring them to the table to talk about their drug pricing, I think that's low-hanging fruit.
Well, and another area that's going to get a real look at is what they call PBNs, pharmaceutical benefit managers.
Benefit networks, yeah, managers.
These are the middlemen.
These are the middlemen. And that's where the real cuts are taking place. You start getting, again, real free markets, that's going to be
Johnson
squeezed.
& Johnson, by the way, said 47% of the price that you pay for all your drugs goes to the middleman. So
the good news about health care in America, and this really is good news, we blow so much money relative to the size of our economy to pay for it that if we figure out a way to fix it, you're going to see more savings unlocked in people's pockets like you've never seen before. There is so much money up for grabs if we can come up with some better solutions.
Entrepreneurs will do it. They are the ones who invent the Apples and the Amazons of the world, not the federal government.
You know, what bothers me most about these calls for socialized medicine, which is essentially what this is, anyone who supports that should be forced to spend 1 week in a London hospital. Pick any public London hospital. There are only 2 private ones left, by the way, and the only people using those are Arab sheikhs who can pay cash for it because everybody else is kind of forced into the public system. But you spend 1 week there, you see the filth, you see the lack of equipment that they have, the lack of drugs that they have, adequate drugs to deal with the situation they have, the number of MRSAs, that is penicillin-resistant sicknesses that are causing deaths there. I think 1 week there, and a lot of these socialists would be dead set against it.
But aren't you picking the worst case? I mean, rich countries...
England is a pretty rich country.
Rich countries all around this world have universal health care. So what we can do as America is we can go shopping. We can say, I like what you're doing over here. I don't like what you're doing over there. It doesn't have to be the UK. We can go see what are they doing in Germany? What are they doing in Australia? Pick the best parts of what other people are doing. Rip them off and do it for ourselves.
As I mentioned, the system that was just outlined today by the Democrats on Capitol Hill goes further than the Canadian system. And you have a lot of Canadians, by the way, that are still coming to the United States for procedures that they can't get or they have to wait a couple of years for up in Canada.
And David, to your point earlier, send that same socialist person, the socialist Democrat, to the VA for a week and see how their care is. I mean, you know, we've seen this movie before. We even saw it with healthcare.gov. We saw it with Obamacare, with all the people that lost access to their doctors, started seeing a decrease in care. Now, all of a sudden, this Medicare for All thing, I saw you can keep your doctor. Your care is going to get better. I mean, that's a joke. We know how this movie ends, and it's not well.
All right. Last word from Scott. Well, President Trump set to have another historic meeting with Kim Jong-un just a few hours from now. What can we hope to get out of this second meeting with the North Korean leader? We'll take it live to Hanoi, Vietnam for a preview coming next.